Well, hello everybody, and thanks for joining me on the live stream tonight, my new time of 8 p.m. on Facebook and YouTube, and also Instagram. So, tonight I'm going to be addressing the subject of why doctors are not talking about healing chronic pain. And this comes from several sources. One, I had an email recently from a person that I don't know, and they were asking, well, they had lots of pain, and why has nobody been talking about this at a specific pain clinic in BC? Now, many of my patients who come through the door have got a similar question, that the stuff that I talk about, that you're hearing on my live streams, as well as on my podcast show and also in my book, Conquering Chronic Pain, is that it's not being discussed. And what is the reason? So this is a very important question. It's a deep question, and it warrants some expression on this live stream. Well, the medical system is a medical system. It's based on medicine, and it's based on symptoms. If you've got a problem like pain, you're asked about the symptoms. You get a clinical exam done, and therefore you get a diagnosis based on that, as well as tests. And the combination with the test gives you a diagnosis and therefore a treatment plan. And medicine is all about treatment. It's all about treatment. Now, if we go back to the origins of medicine, 2,500 years ago, the father of medicine, Hippocrates, said that food should be your medicine, and medicine should be your food. And now we have the science to back that up. But back in that day, they were looking for causes. They were looking at root reasons for diseases. And if you go back in time, the last century, in the 20th century, halfway through, there was a change in the research. They were about to make big progress into this mind-body connection. And what happened at that time is penicillin was discovered. And then the whole world of big pharma started. And not only big pharma, but also big investigations, and trying to find, biological causes, biochemistry causes of diseases. X-rays, I think, were in the 30s, 40s, and then CT scans later, and then the 80s was MRI scans. So, and now it's just exploded in the last, 10 or 20, 30 years on investigations. And our doctors, like myself, are doing lots of these tests, but unfortunately they don't have answers to chronic pain because it's not a physical problem in the majority of times. Because the big pharmas came in, there was lots of funding away from the psychosomatic or the mind-body connection. And that's the reason we are where we are today, with amazing treatments for many things. Surgery is a huge one. Investigative procedures, like in chronic pain, you get these spinal cord pumps, spinal cord stimulators, and really advanced things that many of the leading pain physicians across Northern America and across the world are performing. But that's only one aspect of chronic pain management, and the subject of healing is not quite mainstream yet, although I think that's changing. But the question is, well, why? Why are they not diving into it? Well, it's not as simple as they should be doing it, because it takes time. It takes time for new knowledge. And the knowledge I'm talking about, like neuroplasticity, the brain can change and can literally create new nerve connections and new nerve cells, and therefore have a different program, a different reality. That research has really only been 10 or 20 years in the literature. And the reality is, as a family doctor, for example, I was once told that if I was to study all this different information around family medicine, then I would spend 21 hours a day, every day of the year, studying medicine. Well, clearly that's not going to happen. And there's just such a wealth of knowledge around so many things. The knowledge of healing, like brain neuroplasticity, epigenetics, has been around 20 years. In fact, it started in the 40s, but really in the last 20 years, so much science has come out and research articles around the subject of how your environment shapes your DNA, which therefore shapes the function of a cell and therefore the healing of pain. The subject of trauma really only came out in the 1989 in a big study called the ACE study, showing that trauma in early childhood is linked to adverse clinical effects later in life, including death, including diseases like diabetes and pain as well. So, but the whole thing of trauma in our childhood is still not, it is being taught at universities, but it's not in the clinical realm because the physicians who, like my age, I'm just 50, and even younger than that, but also older. Now, this was not even known when we went through med school. So, it takes a lot of time for things to become mainstream. So there's too much research for us to know all the different stuff. So that's another reason. Another reason would be the focus. It's a little bit like your vision. Just think about your vision right now. You're looking at a screen, and you're not aware of what's going on behind you, or to the side, or below you, or above you. And it's a bit like that with medicine. We're so focused on what we're doing, what we're trained in, that we don't look peripherally. We don't look behind or above or below us. Well, what else is going on out there? And if you go looking in the literature, there's just so little articles compared to everything else. It's difficult to wean it out. And unless you've got an interest, that ain't going to happen. So that's another reason. Another one is fear. What will happen? What will happen to my career if I start talking about diet for helping healing inflammation, for example? Another new thing that's really come to the forefront in the last 10 years. Inflammation is a cause of chronic disease, chronic pain. What happens if we start talking about diet and nutrition? What will my colleagues think? What will my supervisors think? What will my boards of medicine think? Because we all got audited, we all got assessed. So there's a fear there. Nobody likes to lose their license. Nobody likes to lose their job, and with implications for you personally as well as your family. And there are many doctors who have either moved on from medicine, traditional medicine, or have had their license removed because of doing things outside the box that's not mainstream. And that's very threatening. And we as a human species don't like threat. We're programmed to stay away from it. Safety is the name of the game. Maslow's hierarchy shows that. So, if you step outside the box, a little bit like what I'm doing tonight, then you're at risk of consequences. So that's another reason. I think one thing to say on this is the work of David Hawkins, MD, who has written a brilliant book. I read it many years ago called Power versus Force. And it talks about the consciousness of the planet changing. And it's a logarithmic scale. So it's not like, say, there's 7 billion people on the planet, and half of them have got, say, a third of them have got pain, so roughly 2 billion. So it's not like, half of those people, a billion people with pain, need to be aware of this new science before the table flips, and therefore everybody's talking about it, all doctors are talking about it, and it's just normal. So this logarithmic scale means there's a certain number of people on the planet, or a certain number of doctors on the planet, thinking the same way, aware of the same knowledge, and until the tables flip, and they're for modern day medicine or traditional medicine is actually talking about it. I must make a pitch for functional medicine. These are MDs who are trained traditionally and then went on to study the causes of disease. And Mark Hyman is a very famous doctor from Cleveland, runs the Cleveland Clinic, and he's been pioneering this field for 3 decades now. And I've got colleagues in BC who are who've studied at the Cleveland Clinic and are practicing this type of medicine in the province. So here in BC, there are a few, not many, who are functional medicinally trained. The other approach to causes of disease and pain is naturopathic medicine doctors, because they are learning about that from the day one at their natural medical school. So these are a few reasons. But what is the hope for the future? Well, I think it will take decades for traditional pain clinics to be talking fully. Now, they are starting to talk cognitive behavioral therapy and acceptance commitment therapy treatments, or ACT treatments, are slowly coming into many of the bigger clinics, the multidisciplinary clinics. I know Pain BC in Vancouver, as well as the pain clinics in Surrey and in VGH and St. Paul's, do have these services available. So it's coming in slowly, but maybe not quite to the level that the science is showing about neuroplasticity, about epigenetics, about trauma, and about inflammation. And I would love to see that explode into not just pain clinics, but also every family practice, where 50% of doctors end up, because they're the ones in the trenches dealing with the bread and butter of medicine, like chronic pain. So, just one story of hope is a Dr. Mona Mubarak is her name, from Dublin. She's a colleague who I've had many discussions with her on my podcast show, and she is a fully trained across the world, Australia, England, working in Ireland, and also trained in the States in multiple levels of chronic pain. And she's very open to the treatment of inflammation. She's very open to diet and the role of diet in healing pain, as well as bridging that with all the modern high-tech treatment modalities. So it's coming. It's slow, but it's coming. So I think the other thing to say is, online is a great resource for looking up on YouTube and podcast shows about these different ways of diving into the causes of pain. And like myself, there are several of us out there doing the work and bringing awareness, because awareness is the first step to change. And I think I'll just finish with two things, and that's a very famous statement by a very famous person, a visionary of his time, called Buckminster Fuller. And he says, if you want to see change, you've got to be the change. You've got to go out and be the change. You can't expect the system, the medical system, to change. You've got to be it yourself. And also it rhymes with Mahatma Gandhi when he was dealing with the British, and after many hundreds of years of colonization in India, eventually that changed, and the Brits saw the wisdom in it and basically pulled out in 1947. So, as my son gives me a question. So, things do change. It takes time, but we need to be the change if we want to. We need to be the change if we want to see that change, and it's our own responsibility, wherever we are in this field. And I'll just wrap it up by informing you, below this video there's a link. My e-course, online course, is now available for healing chronic pain. If you're interested, check it out. And also the Facebook group that is up and running now. I'm being more proactive and answering questions, and that's about education. It's about just building a community of people who are interested in healing pain, learning, growing, and moving forward. It's very little benefit, I think, comes from complaining and looking at all the negatives. We need to be looking at the new research. We need to be positive. We need to have faith and certainty on the journey. And that's been definitely my story in the last 5 years or so, as I came across the work of John Sarno and started to realize myself, oh my gosh, there is actually solutions for pain. And there certainly are. And that would be my testimony after many years of doing this live streaming and also my podcast show. So, thanks for listening. Please give me comments. Please respond by email if you want, or on YouTube, or the traditional ways. So give me some likes here on ring the bell, notifications on Facebook also, and YouTube. And thanks so much for listening. So take care, and I'll see you next week at the new time, 8 p.m. Thursday Pacific. Take care. Thanks for joining the course. I look forward to seeing you next time.